A lot of people get recommended EMDR when other kinds of therapy isn't working, and that sort of that makes sense on one level. There's something that maybe talk therapy isn't touching, but then they're frustrated because they've been at it for a while and they
Yeah.
want to move past this. And
Yeah.
so, you're not necessarily their first therapist, and
Yeah.
they want to see change.
Yeah. Usually, if that's the case, we often find, right, Avi, that it is somebody who has experienced
Yeah,
early childhood
yeah,
trauma or
yeah.
distress, right? Um, a couple of things come to mind. One thing is that there's a lot of research and training accessible to us as therapists that handle that very part, right? There's early trauma protocols for
Mm-hmm.
EMDR, for
Mm-hmm.
instance, and
Yeah.
that also involves really investing in that preparatory phase, and that is also EMDR, right? That is what we have to make clear, is that it is not just the eye movement or the things that we might have seen on social media or on TV. That is just one part. And the other thing that comes to mind is that also is kind of a beauty of EMDR is we don't always have to use words.
Mm-hmm.
Um, and on the one hand, for some people, talk therapy might have been very distressing because talking about it just makes them so anxious or triggers panic or intense shame. And with EMDR, there are ways of moving at a fast clip where you're not necessarily recounting your whole life story or the traumatic memory. We can use shorthands, we can use code words. As you're going through the reprocessing, you don't have to tell the therapist everything that you're experiencing. For some people, it can be relieving to hear those parts too when we explain why it could take longer.
Mm-hmm.
Yeah, I think that's what's coming to mind
Yeah, yeah,
now.
yeah. I mean, I think you're describing something that can be very flexible for people, right?
Mhm.
But that also, I think, requires people to similarly be flexible with themselves and
Mhm,
accept
yeah.
where they are, which is always a
Yeah, and
requirement in therapy.
right, and sometimes educating what happens to us physiologically when we experience trauma or when we
Hmm.
experience it at an early age is also a big revelation,
Hmm.
right? If I say to someone that your nervous system responded to this distress in the hospital when you were an infant by dissociating, and
Yes.
so that circuitry to your full emotions was disconnected and it hasn't been reconnected since,
Hmm.
and that's where we have to start. We have to
Hmm.
start with connecting to your body and to your emotions again. Being able to explain some of that physiological, neurobiological stuff, even though that's not at all what we're trained in as psychotherapists, can be very organizing and helpful for some
Yeah.
people as well.
Yeah.
Yeah.